As awareness of mental health issues grows across the state, experts are looking for effective treatments. Well, Measure 109 would make Oregon the first state in the country to legalize psilocybin therapies, which experts say show promise. But as KEZI 9 News reporter Chris Lewinberg shows us, opponents say that being on the cutting edge comes with risks.
Psilocybin is a naturally occurring compound in what's commonly referred to as magic mushrooms. Experts say that when ingested, it acts on serotonin receptors in the brain. Its mind-altering effects distort perception, which some say helps users see things in a new light and promote mindfulness. Dr. Nick Gideons is the medical director of 2 hospice centers in the Salem and Portland areas, giving end-of-life care to up to 125 people at a time.
A substantial number of those, not most, but a substantial number, can really be stuck in cycles of anxiety and depression over profound distress at what they're facing in their end-of-life care, really existential questions, doubt, and dread.
Dr. Gideons thinks psilocybin could help some patients make breakthroughs and find relief.
I see the potential of profound benefit, maybe not for very large numbers of patients, but very profound benefit for some patients.
While Dr. Gideon sees opportunities for end-of-life care, proponents point to studies from research institutions that show that psilocybin can assist those dealing with anxiety, depression, or even addiction.
I encountered psilocybin, and I don't know what else to say.
But the Oregon Psychiatric Physicians Association opposes the measure, pointing out that the Federal Food and Drug Administration has only designated it as a breakthrough treatment for major depressive disorder.
We take rare political stands, but when we are concerned about our patients, then that's when we're going to take a political stand, and that's what we've done with Measure 109.
President Dr. Nicole Serino says that psilocybin can unmask or worsen psychiatric illness or psychotic disorders. She believes that for now, psilocybin should stay in a medical setting.
But what they've actually done is kind of stripped medical and mental health monitoring from the psilocybin facilities by, like I said, not requiring a prescription, not requiring a diagnosis or a medical evaluation or a mental health evaluation. And they're in facilities that are not medical facilities.
While the measure legalizes the production and distribution of psilocybin, the administration of it would involve a preparation session in which facilitators look for risk factors, the actual administration session in which a client consumes it under supervision, lasting as long as 6 hours, and an integration session in which the client reflects on the experience.
It's not legal for recreation. It's not sold in stores.
The measure would require the Oregon Health Authority to develop regulations for 2 years that would determine who gets screened out as a client and how intensely facilitators are trained. The text of the measure requires only that the facilitators have a GED, complete that training, and pass an examination.
Competence and safety are our top values going into this, and it's doable.
Chief Petitioner Tom Eckert says that opponents want psilocybin regulated as a pharmaceutical drug instead of a naturally occurring therapeutic agent.
I see no reason to kind of stop anyone from accessing these services as long as they can safely benefit, because we're all a little bit wounded and we all have growth to do, and that's what this is all about.
Though he understands some people's reservations, Dr. Gideon says he believes these rules would control use enough to keep clients safe.
We're looking at the same evidence. We're just looking at the risk and benefit ratio somewhat differently.
The measure says that taxes on psilocybin would pay for its own regulatory program, but that 2-year development period, potentially ending in December of 2022, would cost $5.4 million coming from the state's general fund. In the newsroom, Chris Lewinberg, KEZI 9 News.